I will integrate infection side of the shoulder and integrate now, most people that have still represent the they are not gay, that they are hospitals, gay, that they are and there are also peanut they are presentation in the hospital. And by the time we do a physical examination, give evidence of long-standing hypertension, that means that hypertension has been observed by the majority of people that represent are those who are not aware that they are hypertension. Now, for the hypertensive patient who are not regular on their next group of then now the hypertension, we need to understand that hypertension generally does not have not waiting for symptoms of hypertension. By the time you are getting symptoms of hypertension, that means you are already developing complications. Hypertension is defined as a silent killer, does not have any symptoms. So there's any symptom, anything you call it, they are all symptoms of this heart. They are all just of this heart. Sorry, they are all just complications of hypertension. Not symptoms of hypertension. What do you mean that malaria now? You can say that symptoms of malaria and the COVID joint pain. But there is no symptoms that can be attributed to hypertension. There is not one of the hypertension without by the time you now develop this symptom, probably they are not developed because we remove it correctly, quickly. If the doctor ensure that you always be normally all the time, and if you have BP that will want everybody irrespective of your age, 1 if everybody can achieve 1 it has to develop it and it will use to be very Thank you.
I hope you have read that BP targets, all of us should work towards at 120-70. If you have a noise maker, it's on, and you are not taking anything, take that as a take of motivation. Let's work towards that. Don't wait until you are ready, or until you become conscious, before you know that. By the time you are very unconscious, you are coming to it. Because most likely you are playing with your brain. I'm going to operate a patient to you. I are playing into you. It's unconscious. I'm going to operate it to me. They are playing into you. And it's because we managed it earlier. Did well without any surgery, and went home. He was taking. He will take the drug today. It will take like 2 or 3 days. Take it later. Now, when he came to hospital yesterday, the BP was 180. 181. Some people will come to 240. What will be the last BP of almost 200? So, don't let us commonize hypertension. It's not HIV, I'm okay. It's not cancer, I'm okay. Hypertension is deadlier than all those things. It's deadlier than HIV, deadlier than cancer. Body control hypertension. So let's take note of that. So I'll come to you, Dr. Olede. In the introductory remarks, you mentioned of mental health. Mental health is a big issue and society. You see someone who just carry bottle, drink on someone's head. It's not mentally okay. That act of violence is as a result of an unstable mental state. You see someone, and the Gabalo people, they will open the shop together and close it. It's a mental disequilibrium. So, not only they tell us, let us run through depression, and what is depression? What do let our audience know what depression is. What are those factors, those psychosocial stressors that can expose someone to depression? You will see someone at the time you need to act, you refuse to act. Someone who just lost a loved one, you need to see a dog. But you know, in this part of the world, once people visit such person, say, no, in the life, take acts, all those things. People will not know. That person has the risk to develop depression. You see someone contract did not materialize or manage it yourself. Just manage it home. So if you help us to run through that so that we can know what are those telltale stressors exposed to depression. But
thank you for the question. Depression, the sad, means extreme sadness that appears in daily life. Extreme sadness here means that somebody is sad to the extent that he doesn't care about how he looks. He thinks of negative things and to the extent that it may even make the person think of suicide. And this depression we are talking about is one of the most common mental health problems that are often overlooked. Because when it comes to mental health, people think because they are not having any, they are not having abdominal pain or anything, so they will think they are fine. But their mental health is being affected. So, and in the society that we find ourselves, there is a stigma attached to psychiatric patients. That is a patient that is suffering from mental health problems. So, and then that will make the person not to seek medical care as appropriate. So now, let me explain this. Mood, which means state of feeling. Somebody can be sad, somebody can be happy because of the events of life. Sometimes it's normal. Something happens to you, you can feel sad. It's normal. Something happens to you, that makes you feel happy. But the activity of it, depending on how quick the loss is, somebody can be extremely sad. But if this sadness persists for a long period of time, then it becomes significant. Let's get that clear. Somebody can be sad, can be happy. But when it becomes extreme, one, and when it lasts for a long period of time, then it becomes significant. And apart from being sad, there are other symptoms that that may accompany this. Part of it is this will be feeling helpless, will be feeling hopeless, that doesn't even have any hope in this life, will be feeling worthless, that doesn't have any worth. Person may be sleeping excessively, or may not even be getting enough sleep. So now, coming to the second question, what are the psychosocial stresses of depression, or in other words, what are the risk factors, what are those things that can tilt the patient or that can tilt the person into depression? Yes, the most important factor is the psychosocial stresses, and what we all pass through in life. It's as Muslims, we are not promised that we are going to be having it smooth all along. There will be what? Wrong roads are going to be smooth. So it depends on how we handle this issue. So now, loss of job may be a psychological stressor. But just before we did test the office and then we see the examination letter from the boss. So that may be a psychological stressor. Then unemployment, you don't have a job, may be a psychological stressor. Then marital conflict, because all these are psychosocial stressors that may tip somebody into depression. And that's why this can happen to anybody, but the way we handle it matters a lot. So let me stop.
Thank you so much, Doctor. Before you leave that spot, there's something mentioned. There are actually two key issues. Both are interwoven. And one of it is the economic disaster. Economic disaster span through loss of job, unemployment. Or you are even employed but not able to get employed. Because this is definitely radical. If you cannot manage to crisis, you're asking for something else, purpose or the other, or you start fighting. So, man will respond to. How can we prevent depression, family issues? If we say there will be family issues, conflict within marriages, we are not deceiving ourselves. Conflict will just really in decrease, but there will always be conflicts. So how can we prevent depression from coming in situation family conflicts?
Thank you for the question. Before I answer the question, other things that also can be exposed to depression is chronic medical condition. If somebody is suffering from, let me just be familiar terms that have been mentioned here today. Back pain, stroke, or cancer. Somebody has been diagnosed to have one part of the body and the line is paralyzed. So those kinds of conditions, because they are chronic, they say that they may be there for a long period of time. So it may tilt somebody into depression. Cancer, you have been diagnosed, somebody has been diagnosed of having cancer of the brain, which you have been told that this is malignant. It says that it has a rapid rate of growth and then it is not curable, it cannot really be operated. So those kind of conditions can see somebody into depression. So now, coming to prevention, how do we prevent depression? Depending on what psychosocial structure is. So now, the family psychosocial stressor. And this it requires a lot of patience in a marital engagement. Patience is very, very important, especially when it comes to a husband. We have to tolerate a lot of things from our wives because if uh, issues come up, we don't always react extremely or excessively. Let's be patient with each other and then let's sit down, dialogue, and sort issues out. So this will go a long way in keeping the marriage. Also, other side of social stressors.
Let me hold your thoughts. Still, I'm more interested in this family competence. You mentioned the key issue, identify the social stress. For a man in the house, if you know that money or providing for the family is usually what causes problem. So we discussed in the capacity building yesterday, during the professional forum. Double well, number C, not power nine, double well, on your income. So that what you have identified as a problem, I just want to add again, in most cases, when we are, to us, naturally, culturally, once an issue between husband and wife, whether they contact family member, and either the aunt or the sister of the husband will come and tell the wife, you are leaving this house. So conflict resolution in marriages, have we been able to approach it? We giving it the appropriate approach in our traditional setting. I know in the developed world, they have all this marriage counseling, all those things. And we also use all those methods to manage.
When it comes to conflict resolution, marriages, Islam has taught us on how to go about this. Husband being the head of the family has to take the bull by the horn. So, women, wives, they will always make mistakes. Husband will also make mistakes. So it is important, firstly, to understand each other very, very well. You understand your wife, you know what she wants, you know what makes her happy, you know what makes her sad, and then you treat as appropriate, and the vice versa. Now, when conflict happens, the husband has the big role in this. It has to start within the home. Not that something just happened and then you skyrocket it to the family, extended family. No, that's not how it's taught us to way about it. Sit down your wife. You can't be issues among yourselves. Point out our mistakes, and then you have to be exercise caution. In a case whereby you are the culprit, so know it that you are the one that is wrong. You must not accept the fact that you are the one that is wrong. That matter is not to settle. Because the Bible expects that you confess that you are the one that is wrong and then seek forgiveness. Because without that, the matter will not settle. Even it will even increase the confidence of the wife that no, you know that you are wrong and then you seek apology.
Exactly. So, in essence, each partner should accept its own fault, whenever it is fault. That's a major issue. Only the with ego on both sides. Nobody is going to say so. They just allow it. Sometimes they just allow it to go naturally. That is say that. Mention something very important. We respect the law. As man of the house, you are able to apologize to your wife when the marriage will be, the institution will be strong. The future conflicts will be minimized. But most homes, ego is a major issue of both sides. Let me go to Dr. Sam. Have you been able to, are you clear about look at some of the common factors, some of these common cancers? How can we recognize some specific cancers? Concept of medical practice, especially for cancers. You can pick it early, there's still hope of managing it better before it spreads to that part. I hope you help us run through some of the common factors and how we can diagnose it early.
Yeah. So these factors often affect cancers. Many cancers do not have specific symptoms, do not have specific risk factors. However, some specific, if the family member or the family history of cancer, or anyone who has a family of cancer, that automatically put the person at risk. So being aware of this will enable prevention strategies and early detection with regards to early screening. Then another thing is before people assume that cancer was a disease of older, but now cancer has no age. There are some cancers that appear to young, some cancers that appear to be old, but now there are some cancers that don't have age limit. So, for example, if someone has a risk of colorectal cancer, probably they have a family member who has died of colorectal cancer, or who has been managed for colorectal cancer.
The colorectal cancer she's been talking about, cancer that affects the
Cancer of the large
intestine.
colon, large intestine. So the cancer of the large intestine is particularly and has genetic predisposition. It's also related to the gene that causes is related to some other cancers. So if someone has a family member that has died of colon cancer, for example, then all the family members have to watch out for breast cancer, colon cancer, ovarian. So, for cases of prostate cancer as well, the family member has died of prostate cancer. Then all the family members should start getting screened, especially from age 40. I believe the last ITP, prostate cancer screening, was held, right? So, because of how common it is and how it is the health social insurance, the one that is giving it a niche, and the niche breast and cervical cancer. So, how many of these cancers are preventable, but how do we prevent? Whether you have a family history or you don't have a family history, screening early is very good. For those with family histories, starting colonoscopy, that is endoscopy of the colon.
Sorry, before you go to prevention, are there social habits
Oh,
We have heard about smoking, alcoholism, all those things, taking of smoke, all those habits are they truly predisposing factors to cancer?
so I was talking about other risk factors is just smoking. And for smoking, you don't have to be a smoker. So second-hand smoke is also a high risk factor. And I believe we need them, we need them. So I believe lessons from here was also taken out of it. So smoking is a major risk factor for almost all cancers. We have very few cancers that have smoking as protective. Why not protective is the environment? So most cancers are predisposed by smoking. Alcohol intake is also a risk factor, and especially excessive alcohol intake. That is, there are some occupations or living environment predisposed to cancer. So if you live in a place where they mine, so those kind of environment causes the release of some certain fumes and chemicals. So that can predispose people in that environment to cancer. People that live where they mine things like limestone, potash. So those are listed at high risk. People that work in paint industries, that work, because I know Nigerians don't take personal protective equipment seriously. So even if I work is to provide personal protective equipment, many of us take it for granted. But then, once it's provided, you cannot get insurance claims from the government. If these diseases eventually, because these things are real. So there are some chemical factories where they make paint, where they make asbestos, where they make pencil from lead, where they make car batteries. So these are predisposing factors for cancer. Then there are some foods, our diet, poor diet can predispose to cancer. So when we talk about prevention, we talk about how to prevent. But not eating balanced diet, eating mostly highly processed foods, because most of these processed foods have some certain substances that can be exposed to. So just to mention.
Thank you so much for that insight. So, you that you are fond of eating poorly cooked nuts, poorly cooked nuts. Some of those nuts are affected by some mold, which produces aflatoxins. Aflatoxin is a culprit in liver cancers. Just to avoid taking cannot have. Roasted or roasted and grilled oil is usually done. Offended granules, just the little granule. Some people are talking about smoked food products. And the question most of you will ask is that, Madam Melo, they are eating sugar since surprisingly they are not developed cancer. Cancer doesn't develop like that. You may be eating the sugar and they will develop cancer. In most cases, there are two factors that will come into play. We call it two heat hypothesis. The first heat is usually genetic that she talk about. And we don't know who has a genetic problem or the other. None of us is aware. We don't know. You now sit down with your regard by smoking. So the second heat will come from that smoke. Either you are not smoking it or you are fond of sitting beside people that smoke. Passive smoker. not sit down with suya, you be taking hydrocarbons. I don't know sugar. You love it. People have developed stomach cancer. They don't come and tell you. And they don't show on time on what she said. But it grows and it's also problem. Let's be mindful of our lives. Let's be mindful of what we do. Back to Dr. Fitz. I know you have a lot of commitments here now, so that you can please your time. You'll be able to talk to us on what stroke is, how common stroke in the environment, how great it is. I want you to quickly help us shed more light on those risk factors. For example, there's something a common issue now among the young age group. Substance abuse. There was one boy brought him to the hospital. They brought him unconscious. He fainted. A university boy, they brought him. By the time he took the urine, he detected 16 different substances inside the urine. Marijuana, cocaine, LSDs, substance. 16 the urine. Let's teach our children. Let's pay attention to our children. The society is telling them something else that is different from what you are telling them. Society is telling them something. Attack, take food. You have control over the use of that. Society will teach your child. Don't teach your child. So please help us quickly run through some of those other risk factors. How can we know that someone has developed stroke? And what are the immediate advice we can give? Are there any warning signs? If they are, what are those things we should all look out for? And what are the quick intervention we can put in?
All right, so competition activities we've noticed that most young people present with hypertension, the time you interact with them, you find out that they are using one substance. So substance abuse, especially in other risk factors, generally we divided into these factors. We call one non-modified risk factors and then modified risk. Yes, and those risk factors that you have no control over. But in fact, those are those things that have been inherited as a result of genetics to have control over them. So one of the major risk factors of stroke is old age. As one is growing older, the risk of stroke is increasing. It is said that at the age of 85 and 55 and above are at risk of stroke. So there's nothing we can do about age. Another risk factor, another non-modifiable risk factor is race. The fact that we are black also put additional risk factors on us. Initially, as a doctor, I disagree with this. I felt it's part of the racial racism that is going on, that there is some form of racism against us. That's why they ascribe all the parties to us. But from evidence available, a research was conducted in Abuja, and they used looking as a study population or study area, and same with similar age group with similar research that took place in Netherlands. They were looking for risk factors for stroke, who usually develop stroke, complication of strokes, and they are comparing the two groups of people. Group A represents black race, while there's a city too in Netherlands that represented the Caucasian. So they found that number one, people develop hypertension at a younger age as compared to the people in Netherlands. That's one. Number two is that the complication, even when they develop hypertension, the complication among the black people is far higher as compared to the white people. And this one was conducted by black people in Nigeria, in the University of Abuja. So I have no reason to doubt that assumption that black people are at higher risk of developing stroke. Another factor is the family history of stroke. If you have a family member who develops stroke, probably at a younger age, family member, we are more interested in the immediate family member, maybe your auntie, your uncle, your parents, or your siblings developing stroke at a younger age. There is a high chance that one is also at developing stroke. And the worst part of this is previous stroke. If one has developed stroke before, that particular person has 2 times higher risk of developing stroke as compared to others who have not developed stroke. Those are the non-modified risk factors. And lastly, male. The fact that you are a male gender also predisposes you to developing stroke. A lot of factors, we are the breadwinner, moving up and down, looking for how to maintain the family, carry the problem with the family. I feel that might contribute to the fact that male gender are higher risk of developing stroke. So the modified risk factors, those are the risk factors that you have capacity over, that you can control. Number one is hypertension that we have talked extensively on. Hello, are you following me? Hello? Hello? All right, thank you. So, hypertension is number one among modifiable risk factors. As I said earlier, we can control it. We have capacity we have the possibility to have control over that. So, then another second commonest risk factor under modified is diabetes. Diabetes is like if you have diabetes and it's poorly controlled, that also predisposes to stroke. Another one is dyslipidemia, that is high cholesterol. So that comes from bad habits many times. But though we have some individuals who also have risk factors, genetic abnormalities that make them develop, produce abnormal cholesterol. Anybody with abnormal, high amount of abnormal cholesterol is also at risk of developing stroke. Another one is obesity. People who are obese as compared to people who are able to maintain adequate, normal weight at risk of developing stroke. Sedentary lifestyle. So, especially this is common among people that work in the office, people like us, bankers, lawyers, and so on, as compared to the artisans who are moving up and down as part of the requirements for their job. People who sit down a lot in the hospital, in their place of work, sitting down, they are going to the market, they take a car or take a bike, who are not in any form, who do not engage in any form of activity. They are at risk of developing stroke. Other risk factors include smoking, alcohol consumption. And lastly, is also buttress what I said earlier, mental health. people with psychosocial problems, people with depression, they are higher risk of developing stroke. So I feel are risk factors for developing it. Now let's talk about hello, can I continue? Can I continue? Yes.
Yes. Can you quickly tell us when we should receive medical attention? Or what are those routine medical checks you can be doing? What are those routine? What are the routine medical checks? People that have all these risk factors can be undergoing and at what age? So that it will be like a take-home message from our body.
Above the age of 45, who do not have family history, people who have family history, we are going to use we are dividing into two groups. People who are at risk, people who are not at risk. People who are at risk, especially for the non-modifiable risk factor. Your parent has stroke, your uncle, your auntie has stroke, then you are at risk. So your own screening will be at a younger age. From the age of 40, anyone who has family history of stroke should be undergoing screening at least annually. However, people who do not have those family history by the age of 45, they should undergo the following screening regularly. Now, blood pressure, at least you should check your blood pressure. If you are not hypertensive, check your blood pressure at least every 3 months to 6 months. Every 3 months to 6 months if you are not hypertensive. But for those who are hypertensive, you ensure that you visit your doctor regularly, at least every month, until your doctor is satisfied with you and puts you on a longer treatment. Don't take your drugs alone and run away from the hospital. You must be interacting with your doctor at least every month until the doctor is satisfied. When the doctor is satisfied with your blood pressure, at least when your blood pressure is around 120/70, maintaining that level, even if you are not taking your drug for 2 or 3 days, your BP still maintain 120/70. That is a very good time for the doctor to give you a longer, like 3 months, 4 months, 6 months. So another thing that must be done is you must also be checking your blood sugar. Anybody with family history of diabetes, you check your blood sugar at least every 6 months at the age of 60. So at the age of 40, if you have family history of diabetes. And then for those who do not have family history of diabetes, they need to be checking their blood sugar annually from the age of 40. But by 45 years of age, you check your blood sugar at least every 6 months to be sure that you are not tilting towards diabetes. And I want you to know that all these disease conditions do not come up suddenly. They move the development is progressive. It does not just start suddenly like that. Let me explain further. If you have your blood sugar to be around 5 or something in January, probably in February, in December, you check the blood sugar, it has risen to 5.8. That is telling you that something needs to be done. But if you are not checking regularly, you won't be able to know when there is a need for you to be more aggressive with your control. So, apart from diabetes, blood pressure, you also need to be checking your level of cholesterol, at least annually. Level of cholesterol you need to check annually for people who are not hypertensive, who are not diabetic, irrespective of the gender. You check your, as I said, I told you earlier that one of the risk factors for diabetes, for stroke, is abnormal cholesterol. What the abnormal cholesterol often do is that it gets deposited in the lining of the blood vessel. And after some time, they can obstruct blood flow. And if you could remember, I said stroke can be divided into two. Either there is an illusion of blood supply to a part of it, or there is a rupture of blood vessel that supplies part of the brain. So abnormal cholesterol is often one of the causes of the occlusion of blood supply to the heart. So aside blood pressure, blood sugar, we must also be regularly checking our level of cholesterol. And more importantly, we must try as much as possible to maintain adequate weight, engaging in regular exercise as much as we can tolerate. We often advise that you should engage in regular exercise at least 5 times in a week. Probably each episode of the or each period of exercise should last for like 15 to 30 minutes. Not a competitive exercise, but just moderate exercise. We call it moderate intensity exercise. Even walking around, brisk walking that walk very fast for like 15, 30 minutes is adequate for us for you to qualify as someone who is exercising. So, and then avoid passive smoking, avoid alcohol consumption, and then let's manage our mental health very well. If you're able to manage through all these things, and then put prayer in that. So, the chance of, in a way, contributed our own quota in preventing stroke. As I told you, stroke has modified risk factor and non-modified risk factor. The modified risk factor, we have control over it. If we engage in all these things that I mentioned, we will have been able to at least do something concerning the modified risk factor. And then lastly, what are the signs that we need to pick? Note, the sign of stroke often comes suddenly, but occasionally it can be a warning sign. One of the common warning signs is what we call numbness. You just notice that all of a sudden, the part of your body becoming numb. Numb in what we call it paja. So you notice probably your hand, your leg, your lips, or any part of your body. We are having numbness occurring. We advise you that number one, you check your blood pressure. Number two, check your blood sugar. Number three, check your level of blood cholesterol and interact with your doctor that you are having this kind of. However, there are many causes of numbness, but numbness is one of the telltale signs that you will likely be suffering from stroke. You may likely develop stroke in the next few hours, in the next few months, or in the next few years. So another thing that you can observe is that occasionally you just notice that your face become, or your hand become paralyzed, and all of a sudden, the whole initially you find it difficult to lift the hand, but within a few seconds you're able to lift the hand. So that is a very strong warning that if you do not do anything, probably in the next few hours, the next few days to weeks, you will likely develop stroke. And major, even occasionally, some people will have what we call transient blindness. Just all of a sudden, you won't be able to see, and within a few minutes, the vision will gain your vision again. It's also one of the telltale signs that there's something wrong, something abnormal is coming very fast. And then, if you don't develop this abnormality, take for instance, now, you notice that you just wake up and you find it difficult to talk. Find it difficult to raise up your hand there. I advise you don't rush to the tertiary institution. I will not advise you to go to your private hospital, maybe the hospital that you are using for management of malaria and so on and so forth. You want to quickly request that you be transported to a tertiary institution where they can easily initiate treatment for you. However, if you notice that your hand or leg you can't move it, as a way of although one can make mistakes, but it is advised that there's a drug called vasopressin or low aspirin. So you could take aspirin and then be on your way to the hospital, especially for people who are hypertensive, who are diabetic. You notice that you do not lift your hand, you do not lift your leg all of a sudden. Then, while you're on your way to the hospital, you may take aspirin. But I will advise that instead of doing that, unless you feel that going to hospital may
the please help us send another name. So while we are waiting for that, we'll want to entertain questions and contributions from the audience. Um, can we signify to have question or contribution? One, two. So we have two people. Number one, this man. Number two. Number three. So as Dr. Ina will give us a round up your thoughts, just telling us specifically, are there ways by which we can prevent cancer? Are there ways by which we can screen for cancer? You mentioned on some screening protocol. But we want our audience to go home with certain information regarding screening, and also if how to recognize from early sign that cancer is developing at this particular value. So give us your random thought on that after the question session.
My question is on the issue of BP. What's the correlation if we are talking about low BP? Because, like what the doctor said, he said it's 120, 150, 70, over 70. If somebody has been for almost a year in regular checking and observe that the that 120 is around 105, 110, over 60, sometimes 55. There they allow you about that. That's possible. Then related to that is also of sugar. The same person is also having low sugar. His sugar is around 3.2. It's not 4 point. That already. Then the last day was the issue of cancer, the issue of smoking. Is it only cigarette smoking that is contagious? Or smoking and other smoking are also a risk. What
The question is the emotional trauma. Probably the environment as Africans who visit those that was that there was the bereaved. Because of the explanation you're talking of those that will visit and are bereaved. We go there to tell them that the love of marriage has taken and has taken all that will go. What exactly is the profession we need to tell that person? I will bring that person out of what he or she is facing. Safety to my brother here, those sometimes we are cool, we are around as family, we have those that are emotionally down. What exactly we need to telling them? Before we ask, maybe it may help, or we say we look for specialists to take them to as time to thank you.
Sorry, talk about that nowadays is for constant and regular check. I know of someone that with blood sugar level, say maybe sometimes every when they check the blood fasting blood sugar, I understand there's fasting and there's normal blood sugar. So for the fasting blood sugar, checked around say maybe April, the measurement was around 4.5. But by the time I was going to check, maybe say a week ago, it was 6.0. So can you advise or what precaution and what kind of thing? Because the level at which we went from was quite unexpected. Dr. Sakina talked about colon cancer. So how can we get the issue of stomach cancer? What are the symptoms?
We have very limited time. We have just barely 7 minutes to end this session. So, Doctor, please, 2 questions for you. So, we have questions for you, Doctor. So, I hope you are with me. Doctor, please. Okay. One of the questions is on blood pressure. When do you say blood pressure is low? So we have to start getting worried. And also, same thing to blood sugar. And now we are going to match that question to the last person that asked this question regarding fluctuating values in blood sugar check. At what point should the person be worried about what are those next steps? So, the other questions are 2 guests here. Okay. Just 10 minutes.
Last question. I think the last question on blood signals.
The last question.
Yes.
Blood sugar. Someone took his fast blood sugar a few months ago. Came out to 4.5. After 6 months, it was 6. Fluctuating values. The person is worried about it. So what kind of assurance, what kind of advice do you give the person?
So the definition of blood pressure differs from individual to individual. Now, for people who are not hypertensive, the blood pressure will be low if the systolic is less than 100 and the diastolic is less than 60. For people who are not hypertensive. However, there are some group of people that their own normal blood pressure is 90/60. So such an individual that is now blood rated, and if they do not have any symptoms, so we leave them like that. For people whose blood pressure is far above that and they are having blood pressure of less than 100/60, this is for individuals who are not hypertensive. But for people who are hypertensive, we do not like to peg the value of low blood pressure. We don't like to peg the value for them. Because a blood pressure of 120%, that is the ideal period that we want. Some people may not be able to tolerate it. That 120% may be low for them, especially for older individuals. So, the whole low blood pressure for hypertensive individual is the blood pressure at which they start manifesting symptoms of low blood pressure. That's what we call dizziness. Most of the time we call it dizziness or postural dizziness. When someone wants to stand up and you notice that immediately you start feeling dizzy as you are standing up. Even if your blood pressure is 120/70, it doesn't go into 100/60. That 120/70 will be low. So it is better defined by your doctor. Immediately when you're having symptoms of dizziness, fatigue, then you need to interact with your doctor to help you identify if your blood pressure is too low, or if that particular blood pressure is too low for you. Some people can tolerate up to 110, some people cannot tolerate up to 120. So low blood pressure for hypertensive patient is often individualized. Then as for fluctuating blood sugar, so blood sugar fasting blood sugar is just a marker of what you ate previous days before the blood sugar with the test was run. Now we are 4.5 few months ago and you are now 6 point something. It probably means that number one, you could believe that what you ate the night or 2 days before, or what you ate within that period before the blood sugar was checked was actually not good for you. It's actually making you at risk or visually responsible for the elevated blood sugar. So, such an individual is advised to repeat the blood sugar within a few weeks and see if the fasting blood sugar is still on the high side. If it is still on the high side, it will be that you are going towards developing diabetes. Then you need to start optimizing your diet by ensuring that you eat quickly and do and engage in regular exercise.
Uh, the next question, let me start with Dr. Sam on the issue of did my brother ask a question what someone is predict now is there any protocol that be adopted ensuring that that is being prevented from it?
Thank you, moderator. I'll answer this by saying this question is under prevention of depression as a whole. As we know that if side effects happens to somebody and it persists in a long period of time and somebody in depression. So how we handle how these side effects handle is very, very important. And then the bereaved has a role to play, the family has a role to play, and the community also has a role to play. So now answering this question as a professional, that's the one problem. And then another problem of it is seeing it the eyes of the Muslim professional. So it's going to be addressed in 2 ways. So now addressing it as a professional, if this kind of thing happens, there is what called open strategy. So this is going to be employed in making sure that over time an individual copes and then adjust to this kind of situation that an individual finds himself. So first of all, when it happens, an individual will tend to be niacin. You do not accept that, oh, person that we spoke yesterday, person I saw 10 minutes ago, you are telling me that person has just died. No, the person will be in niacin. So behaving is to administer this kind of individual and then to let him accept the fact that this has happened. Because if he continues to deny it, the denial can, if it gets prolonged, can lead an individual to depression. So it's for an individual to accept the reality that this has happened, this individual has gone and never seen that individual again. So let the individual accept that. And then after the acceptance, then now requires support from the family and then from the community. That's not time to leave that individual alone. So somebody will always need that individual talking to a individual, not leaving because leaving that kind of person allow that individual to be thinking excessively, and this will cause depression. Now, addressing the question as Muslim professional, the first thing is to accept one of the attributes of faith, which is predestination. As a color, that there is what predestination that has been written that this is going to happen, and there is no how you can avoid it. And then believing in need is part of what makes you complete. Rejecting it otherwise.
Yes, Doctor, thank you so much. But our time is fast spent. So actually to really pack that up, um, in this part of the work, we don't, we, as I said earlier, most times stigmatize people that visit the behavioral scientist. So in stages of denial, I talk about that according to Dr. Root, there are 5 stages. At each stage, you need a behavioral scientist to make such individual realize and appreciate well. And a behavioral scientist is not just work of a behavioral scientist. You need a spiritual leaders who are going to tell you what, I mean, the spiritual aspect, what Islam said about men, all those things. So I think that actually, just like that, please, you have just 2 minutes, just to get on some of the prevention.
Prevention strategies are common to most cancers. So, part of things that are very regard to the risk factor. So, for someone who smokes or takes second-hand food, the person stops smoking and avoid risk situations. Frequently, the question of it only single. So, it is not only cigarette. There are different kinds of smoke. Fumes everywhere, the car exhaust, generator exhaust. There are people that their generator exhaust. There are many people that cook with firewood, and that's going to release carbon, and carbon is going to destroy millions. You know, even in the entire world, we are running away from fossil fuel. That is first from petroleum products and all these other products. Many people stop their fires with pure water, nylon, PET, nylon, PET bottles, and all that. So, fumes from all these, constant exposure to them is also a risk factor with respect to use. Another lifestyle pattern is balanced diet, like I'm saying. So let's avoid processing. Let's eat whole food, vegetables, fruits, lots of meat. There's a diet we call Mediterranean diet. There's nothing special to it. It's just a lot of legumes are good, so beans, reduce the white rice. There's the rice that's like father, brown rice, wheat, all some foods. And we should reduce oil for our food. So things like this can also help. So balance diet. And we also have stay active, like the cardiologist said, regular exercise. You don't have to register in the gym. It can just be a morning walk after swimming or a walk after dinner. So just stay active. Park far away so that you can walk a longer distance to your office. All these little things eventually happen. Then for us that are overweight, let's try to maintain a healthy weight. So losing weight is also a big factor, and that's the focus of your diet and your activity level. Then screening and checkups, whether you have a risk factor or not, let's screen and do checkups. It is not that those small things, take it as an investment. We take our cars for servicing. So let's also take our bodies for servicing. So it could be once a year, it could be twice a year. And that brings me to the question of stomach cancer. Stomach cancer can be symptomatic, it can be asymptomatic. Some people have symptoms, some people don't have symptoms. But the common symptoms attributed to stomach cancer, but not always stomach cancer, are symptoms that everybody says they have ulcer. Ulcer, to say you have ulcer, you must have swallowed camera. Say you have ulcer for a fact, endoscopy should be done. So for someone that has risk factor, probably a public member has had stomach cancer, then the person should go for endoscopy. At least once or twice a year. And at least from the age of 40. But for those that have family history, I want to do that. But other symptoms can be vomiting blood, pooling black stool. So these are some symptoms that having heartburn. So these are some symptoms that might suggest it, but most of the time it's not even. Again, we don't know people that are
Yes, sir. Yes,
then
sir.
of course protecting from the sun. So we are in the dry season now and the sun is very hot. So wearing hats, sunglasses, avoiding coming out in the sun and also help protecting from some forms of skin cancer. So in conclusion, prevention they say is better than cure. Most of the things that are highlighted as preventive measures are very little things. So these small habits will eventually go a long way preventing the future. So it's like putting money inside polo, and then you can also take it as a legacy project. Let's do these little things and apply these little habits to stay alive so that we can live long, short life to see our family and our grandchildren.
Yes, sir. We hope that Allah reward our speakers, panelists on this wonderful session. This is where we are going to draw a prophet to this. Allah has set it for us and make it be of benefit to us. Here, there.
Jazakumullah khairan. Let us say Jazakumullah khairan. Jazakumullah khairan to our moderator and all